Doctor, thanks for joining us. Thank you. Appreciate it.
Again, I'd like to thank the AG for giving me the opportunity to be here today and represent the Ohio State Coroners Association. As he's pointed out, this increasing problem with heroin in our communities. Coroners are seeing the devastation caused, not only in the number cited, but as we make these many notifications across the state, we get to hear the tragic stories from families of how the long-term abuse has ripped apart families, often tragic stories that we hear every day. Coroners and medical examiners across the state are working to develop education efforts with other organizations, such as public health, to try to get signs and symptoms, get community awareness, some phenomena such as tolerance and how the community can better understand and prevent overdoses. Clearly, law enforcement has worked hard on the prescription drug abuse problem, which you can see was really combated in 2010. And what's happened is in the streets, we've just switched to what's available. Now in the streets, heroin has become available. My crime lab has actually expanded, our toxicology lab has expanded the age range with which we even look for heroin overdose. We didn't used to go over age 65 because it never happened. We had a 72-year-old die of heroin recently. And we wouldn't have known that except because of this overdose. We've expanded our age range to even look for those cases. So as the prescription drug abuse was contained through efforts of the AG's office and law enforcement, we've seen the switch to heroin. In my county, there's, as I'm able to get these numbers quickly, we've had 92 heroin-related overdoses in 2013. So we're nearly matching our 2012 death total. Many offices, including mine, have also, and the Coroners Association, have made efforts to combine crime lab data with our toxicology lab data so we can stay on top of what's being found in the street through the crime lab to test in the deceased population, to try to see what drugs are causing deaths, including heroin, but also to be able to report more rapidly statistics to the state. As you heard, many of the coroners' offices don't even have an office to work out of in the smaller counties. They don't have electronic records keeping, and they don't have the ability to keep these stats. So as an association, we're working hard through public health initiatives and funding to get more data to decision makers so we can help communities combat this problem. So again, I'm glad to be here. Coroners Association, be on the front line for this effort, and we appreciate the AG being involved.